Yeah, so this is a phase 2 clinical trial that is single center. So we ran it at University of Colorado, and it's given, it's with CC-486, which is the oral formulation of Azacitidine and Venetoclax. The way that we gave the trial is Venetoclax was given per FDA label, so the dose escalation, and it was on 28 days. And then CC-486 was given at 300 milligrams, and it was days 1 through 14. On a 28-day cycle. Now, we did give up to 14 days for patients for count recovery in between cycles. So in terms of the results, we've previously already reported on the relapse refractory cohort, so I'll focus on the newly diagnosed cohort today. So that was 16 patients. They were all either adverse or intermediate risk AML, and we had excellent responses, 56% CR/CRi rates. Now, I will say one of those patients actually had to come off study just for personal reasons in distance. He was responding, and then after a second cycle of standard Aza-Ven, he got into a CR. So it's possible that those response rates are a little bit underestimated. Now, what's interesting is we had P53 mutant patients. So we had 6 patients were P53 mutated. These were high VAF mutations or complex karyotype and P53 mutations. And actually, we had 67% response rate for the patients with P53 mutations, so really good response rates. We previously reported on the safety, pretty safe. Overall, the main AEs were nausea, vomiting, diarrhea, and fatigue, but pretty similar to conventional azacitidine and Venetoclax. So overall, really good responses, and we're very happy with the newly diagnosed cohort. All oral therapy is, I feel like, revolutionizing AML. The patients that have enrolled in the trial have really enjoyed being in an all oral therapy. It has less visits to the infusion center, less visits to our clinic. Some of our long-term patients that are already a year on the trial are really enjoying and traveling. So I think there's a lot of benefits to being in an all oral regimen for a disease that we've really had all IV chemotherapy before. So I think it's really powerful for patients.